activity pertains to our chemicals, not duplication of our main campus. So we have not duplicated our main model to and off campuses. It's a different altogether model of integrated master's program. So that was what my institute is, and today which I could able to do. Why it is so? The institute where even your president started his career as far as the chemical is started, as he's nurtured chemical education, but basically from LIT Nagpur he has done it his UG. Then he been with us for the master's program, and then when he was a regular visitor to ICT, now he is a distinguished alumnus. Of mine with the MTA. Then MTA we have start basically into, and this, if you see the attributes in which the MTA could able to develop, and I'll tell you over the period of my discussion part with you all. And then it is really come to an amazing state where the MTA is today. But we started with literature. That's why I've said to Dr. Raut also, like as he said, CDS or what? CO. So the requirement of that organization, you need to have certain literatures, and also we have done it also the literature. Then as we have done it in literature, through literature okay. Good. So on the basis of this reverse engineering, we have done it on certain materials. So in the process called as a sol gel technique. Just to tell you in the brief, not to take you into the complete detail of it, we have taken it as a solution of one of the material and the gel of another material to form the amalgamation of these two to form the sol gel. So that was a technique by which the first time the material which we have developed of your MTA was this sol gel technology. But then sol gel based developed material was not giving the property which we got it through reverse engineering of the commercial material are the setting temperature, setting time, and the labeling, the strength. So we have changed this technical, or sol gel is a process. Basically it is nothing but the chemical process by which you get the material. So we have changed the sol gel have used one of the gelling material was an organic, whereas the MTA as a final product is an inorganic substance. So this process was not identified. So we have done it and so many experimentation and optimization into an Pickney process. Because first of all, Pickney process are not being mentioned for making it any sort of inorganic material. Forget about MTA. Forget about MTA. So this we have done it. This is the what you can USP of this whole project is like identifying the process right for this, and if the parameters which are being shown here, each parameters are being characterized for multiple times, and then we could able to get it whether this pH needs to maintain, temperature needs to maintain, what not it is. Then we have done it on large scale trials. Large scale trials not in terms of engineering scale up. When we have talked about your department also, we are still it's called it as a TRL 3 or 4 level of your MTA. TRL 5, 6 level are generally a pilot scale level, and above will be the production scale level. So we have done it on large scale in terms of making it rather than the milligrams, we've gone into a certain grams material. Right? So, and then this particular scale of material, then we have done it on in situ loading of opacifiers. So when we got it on material and then done it as far as the material characterization, not in purview of your dentistry, in comparison with benchmark, the opacity was not coming right. There wasn't some transparency or some kind of transparency to the material, so it was not giving opaque. So by just adding in some kind of pigment or a material, probably it was been increasing the overall density of the material. So we have, rather than doing it that, we have done it and some added on certain chemical moieties which can increase the opacity, and that way it has gone. Now this is the timeline. This particular day, which your Dr. Sanjay Patel can remember well, where we have started in 2018. Then we have done the reverse engineering detail. Masters and PhD with me. So last 6-7 years he is working with me on one of the projects in MTA, but some other projects too. So to get it as a fellowship, one was your institute project funding which he was getting it as far as the fellowship is concerned. That was the only commitment of ICT to you to get one fellowship of a PhD. Publications and all. So we applied to a PM fellowship. So PM fellowship is been monitored through PMO. It is a central government PMO organized scheme by CIA. Confederation of Indian Industries is the organization which does it. And they selected nationally certain projects. So whatever the funding which any sponsoring company gives, in your case is the organization. And that was a hurdle, because this was being made for as a companies, and this particular project is being sponsored by an organization. So though it technically got it qualified, but bureaucratically it has came back saying that it is an organization, it was not a company. So then we have given and so much of deliberation from our side saying that though it is an organization, but it is a funding system and whatnot. They considered to be that Siddesh was getting it on one half from this particular project and equal half from PM fellowship. So one day Siddesh is drawing a more salary than that of our all faculties too. As an entry level of assistant professor, Siddesh was drawing it nearly 90 to 93,000 in hand salary rather and fellowship. So till this month he has been drawing the same. So he has worked it a lot also. So as we were knowing that he is getting it into this, So this particular work is related to the funding part. Why I've said, because I've seen it as young minds here. So you have such options in life. It is not all the time needs to go to a higher study for paying something. There are many schemes. If you are biodata and the credentials are intact, you have many schemes by which government funds you. Rather, many funds are been available where takers are not there. But only thing is like only few takers supposed to take that, and you should be in that few. It is not for generalized one. So this is the way, this is the year which is February 2020 where we got it this as a first milestone achieved as far as the research activity which we were doing it to get it selected as a one honor for sure. Whether we will get it an MTA is another part, but getting it a project sponsored by PM Fellowship itself is an honor. So that we got it. Then we have started lacking down on some period related to the MTA reviews with that body and whatnot. Characterization and another review. By doing it all this, we have done it, and the last where your president was also been present. Sharad Karnik was been there in that panel also where PM Fellowship review has been happened last. Then we have done it this as last we have said the in situ, and this is remaining blocks which are being required. So why it is so? Not to your staff or faculty, this particular slide is, it is for you, those who are wearing aprons. Supposed to be a students, right? That's the only demarcation which I could able to notice. So, if somebody is wearing an apron, though is a faculty, I don't want to take it that way. But what I mean to say that any research methodology just in theory, just don't do it. Make it a more of documentation, make it do it a flow pattern for yourself. It is not your institute has asked me to do. If I have done it into the month of March, ke badle November, nobody would have, he only would have said, you should do it fast. But anyway, you should have your own tracks, and then any research, if you really wants to make it into the final conclusion, which may not be a success of a project, which may not be always a positive, which may not be a lead down to an no success, no development, but you should have the object and the activities by a researcher. If you want to do this, you supposed to draw down your own activities, what I supposed to do, not by your research supervisor or something like that. You should know that what activities I supposed to do it at what time. Because if MTA, if we do it later on and 5 years down the line, probably 10 people will come up with the MTA manufacturing. So we have to follow the timeline also. Now this is your MTA, which was been shown into a normal market glass bottle, not into a very fascinated bottle packed into vials and all what you. We already stored the sample that way only into the right set of conditions. But this is a normal glass jar where your MTA has been present, and currently we have an 100 gram at a time we could able to produce it in the lab. And I think so 100 gram is a good enough, at least. So this we don't want it a big setup at this moment. Any given time, if you ask me 200, 300, 400 grams, I could able to do it. That way we have set up the complete process. So one single batch of 100 grams yield, one single batch of 100 gram yield, we could able to get it. And if you see the current cost of your 100 gram MTA material, it's an expensive affair. It's not that easy to store. It should be stored into a very nice jar probably, but it is a MTA which we got it. This is the MTA which is into your vials and all, which we have done it for some other study. That's why it was intact. And one good picture which we have taken it from the table of our research lab, saying that it should be into a proper year. So we had it initially. Two processes which I have mentioned to you, sol gel and then picking. So initially when we got it into, it was into a sol gel which is a transparent one. And though it looks like a transparent liquid, but it was a very thick gel. On drying we could have able to make it as a fine powder, but that powder would have not been an MTA, which is a complete opaque material. So at this, so these are different set of materials. with different concentration, with different opacifier. The final one is this. So these are like at least in this MTA we have done it more than a 400 to 500 experiments for sure, which has been recorded. Few of them may not be because that is an initial part. And then the process 1 which has been optimized, process 2 has been optimized, and formulation and composition of the product, opacifier loading. The good part is intellectual property, which is intellectual rights, is there in our hand now. We can say that this is the formulation which we have done it, the process which we have done it. And important part is like later on, as he was said many times, note to me saying that we have published in one international peer-reviewed 2.4 impact factor journal, where Sharad is also one of the co-author, where for sure he never mentioned to me to put up his name, not at all. Rather he was objecting me to put his name. I said that, but as far as the institute is concerned, as you are the sponsor of this project, and due to which this was your idea, as you have given the money, you would have not put your name. There are so many people, those who donate money to the ICT, and we have so many alumni which probably Sharad Kalmek must have mentioned to you many times as it is, but it is not because of that, but he was the definitely one who said that the MTA needs to be doing at the ICT, which till time in the history of 90 years of ICT, we never investigated MTA. No one has been looked into and the way it is like an MTA. So that's why we say that the food for a thought he has given it. So let us be that way. As it is like a backslide to this intellectual property, which I'll show you later too. Now we are in the stage where we are patenting this information as far as the material is concerned, as far as the process is concerned. Then only we'll hand it over to you even so. It is not like we will give it to the institution just as it was a sponsored project. We'll make it as an IP intact, where ICT is always into the picture altogether. And then whatever you want to do it, we are not saying that you take us our permission to do it, but let us be notified that I may not be there, but my institute will be always there, and it will be an intellectual rights preserved and secured by the institute. Right now, it is like as probably you all are been involved, few of them at least from some inputs of this. Professor Sharma has mentioned to me when during his visit to ICT, as he is ex-director is one part, but he was our teacher also, his teacher also. He mentioned to me, Shashank, why not you do it on this particular material as you have showed me all sort of, but do it with itaconic acid as one of the precursors. And that was his idea. So as Professor Sharma mentioned to me as an itaconic acid, so definitely he must be having something in the mind, and which was there. So itaconic acids which we have done it, and the itaconic acid was being used for glass ionomer cement. So glass ionomer cements are also been into your picture of MTA previously. GIC as one of the initial investigations of your MTA, and certain cements which are being used into and some other applications in biomedical applications where this was being used. But itaconic acids, when you utilize an itaconic acid, it has one problem is related to an toxicological effect also. There are certain literatures available related to as well. You are the right people, but on the basis of the literature and on the basis of that chemical quantity, it decay faster. It won't withstand for a longer time. So there are certain these things. So we have replaced that itaconic acid idea also. Though he has mentioned to, but itaconic acid in the current scenario is not the right way of doing it. So we have done it into the calcium chloride based system. So it is entirely different. Even your biodentin don't have that. So this slide you can understand well. This is our benchmark sample. So currently whatever I have been talking to you as a developed MTA in benchmarking along with your biodentin as one of the materials. So we have analyzed biodentin, and when you ask me like whether we should do it and some approvals required and all, So definitely if you see it into the biodentin, this is the biodentin scanning electron microscopic image. And this is our MTA image. If I would have not mentioned to you, this would have been looked same. Yeah. So we could able to get it even into the physical format also the same. But here there is a fluorine present which is also on the effect shift too, but in our material there is no fluorine present. So the material, always investigators say that this is my work, so it is always good, but not only that way. The chemical class also it can be mentioned that we don't have any toxicological effects too. And that is like there in our that is that part. And the second one, here the success of it, and where you have mentioned to not only to develop MTA, it should be economically viable MTA, which was our commitment to your institute. It was not only developing of MTA, we would have done it in the past first 2 years maybe. Now the MTA per gram cost which we have it in the hand is only at 1500 to 1700 rupees a gram. Yeah. So even we do it and scale up of this material, probably this cost will come down. And which your biodentin is not lesser than the selling cost of 4 to 5,000 rupees minimum a gram. So when it has come to that stage, why it is so? Probably that material is also not that costly in the Western world. I am not pretty sure because I have never investigated that way. But probably you of your friends, some of them which may be doing it there, you can ask them. Only it is like there is no import replacement to your biodentin. So it is a ruling market for the people, those who are not having alternative to your MTA, they sell the material of any cost which they wish to be probably. Otherwise, process-wise, they are also must be having a multiple fold margins into this. So, and the material which we have is completely and which we could able to do it with your replacement of commercial sample as well, much lesser in cost as the selling cost, right? So our commitment to you all related to the development of MTA. You have come on to a very right moment and the right slide too, which we were been talking about as our commitment from ICT to you, and as it is like one of the things which you asked me many a times related to Professor Sharma has been asking about me for adding etaponic acid. So that we have done it, which is with glass ionomer cement, etaponic acids are being used. MTA initially is also onto etaponic acid, and that's why it must have been mentioned to us, both of us saying that tried with etaponic acid. But the etaponic acid has certain toxicological activity due to which etaponic acid was not being used into MTA and recommended for further. And then we have now used the calcium chloride method, which is the right way of the method. And this is our MTA.
So you can claim that it is not going to be harmful at all.
Not at all, because here I showed you this is the exact biodentin which we have taken it as a benchmark material, where even you have the chlorine, all other analysis part, we also have all the chemicals into it, which we have done it with a different process, no chlorine. As well, the cost is per gram is 1500 to 1700 grams per MT as far as the laboratory based raw material cost. If you do the process intensification,
it will come down.
With certain chemical engineering unit operation, we can further come down. So that was the way it was, and then now it is like a detailed report of MTA which we will be submitting in the month of May 2023. Which we will give the complete handover of the samples which we have visited to. At any given time, one single batch I could able to produce 100 gram MTA in my lab of ICT. So any material quantity which they want, we can give.
What do you see then? What is the meaning of physical problem? How do you specify physical problem? It is like color, all these things there.
Then you have to identify your strength also, the compressive strength and all. We have done it, but in terms of you, what you wanted that you have to do it. And then we are into the filing of patent, which will give also submitting a provisional patent filing to June 2023 related to the material composition as well as the process, because here we have changed the material as well as the process.
Are you done?
Yes, I have done.
Please let it one reload on issue. Actually, I wanted it to be here only. Why they have organized on that side? Interaction would have been more, would have been better with
Only that. That's all. Then we came down.
Where is it? For inside? I don't know where probably it is. It's better for interaction. Thank you. Yes.
Thank you so much, sir. It was a privilege to have you among us. Thank you for enlightening us with the valuable information and providing us an insight on this essential project.
I now request Swarani Zodiac to present our Honorable President Sir with a floral bouquet.
Very good afternoon to one and all. I really want to congratulate Shashank, Mhaske sir, who has done so much of homework and so much of variations, so much of work, and ultimately he has come out with MTA, which I think we can claim that it is biologically acceptable.
Yes. I mean, at least on
that-
my perception, it is being.
Yeah. No, what you are saying is absolutely right. Whenever we talk about any material as such in dentistry, they always talk about the biological acceptance, aesthetic acceptance, mechanical performance and all that. And Mhaske sir has let me tell you, this is nothing new to me because I initiated MTA manufacturing process because I had just heard that it is a portal cement, that's all. And I said, if the cements are used so cheaply, why we spend so much money? So that only came to my mind, and with my assistant we started to working on that. We could come out the composition and all that, but we had no scientific approach what we have done. Even I was not knowing what is happening. And one fine morning, I was talking to Sharad sir. It really gives me a lot of pleasure to tell you that if the person has any determination, he can do anything on this earth. And I think this is the right example. I just was discussing with him. I published one paper also on that, FTA. Yeah. But that was our publication. That is Director Medical Education and Research, Govt of Maharashtra. We started one publication when Dr. Taide sir he is from Vidarbha. He was Director Medical Education. I was his colleague as a joint director. We started that, we published that into it, and that's the end of it. I have not seen the material also and all that. Typical government approach. But I am feeling so happy that I just told Sharad sir कि असं आहे, and I think I never said that you work in that. The same day, same moment, he said, yes, I will see to it that I manufacture this material. And I think his commitment of a sentence that time has now, it is materialized. So it's really good. This is not the only thing which actually have to be spoken. There are many other things which we have to speak. But regarding this, I think yes, I think MTA now whatever process will go on, because now the material is there, then there will be evaluation. The physical properties, chemical properties and other properties will be evaluated. Then whether it suits, again we compare with the other materials which are being used on the same line of MTA, or like what sir has mentioned about glass ionomer cement. I think that's right. The glass ionomer cement was the first cement which was claimed to be having a chemical bond with the tooth tissues. All of you know. So I think it will take its time, and then maybe there will be an in vitro studies to be carried out. Then there may be animal studies. Then there may be, and then we have to follow the other procedures with ICMR group and all that, and then we will get permission. But I was discussing with one of my friend Atul Modi, who is the actually manufacturer of dental materials based in Jammu. I will not speak much about it, but I'll tell you, morning only I had discussion with him, and he told me that yes, we are already manufacturing the material. So Dr. Pawar, I am not very sure about it. I said okay, but he mentioned that yes, if there is something new, there is something unique, and I think 3 o'clock we are talking, you are there. I told him that the person who has done the analysis, a researcher, is also present. Our president is also there. So we will call to him at around 3 o'clock. See, he is a manufacturer and he is a very world-known manufacturer. His material is been sold in more than 50 countries. So he is following the European standards and all that. So all those things will happen. But that is a commercial aspect of it, and it will, I think definitely he is interested, he will be doing it, and said big credit. The another thing that yes, the fellowship approval by PMO is not a small thing unless and until there is a matter, because they have a group of the experts who are not only in research but in most of the fields, and they approve and they given it. So one of the most credited thing, I think. So I am sure, I feel very happy to be a part of this day, because so many times he used to tell me that Mhaske sir is doing like this and all that. And today when I was interacting, I said, who is your student? He said, student. See, there is one more important thing I want to convey here, that he is the teacher, he is the professor, he is the dean. But he has not forced his student to come today because of his health problem. And I think this is what every teacher should possess. It's very important. A professor comes, the teacher comes, the guide comes and gives the presentation, and that also will be reviewed by a person like me. Yeah, I was an administrator, I was a teacher, that's a different thing. But no, I was not a researcher. Now dear friends, when I look at the budding dentist, I feel that this is the time that we should not miss. We should see to it that not only MTA, we should manufacture all the materials. We have to work with you. It's not only here. And he has rightly said, but he has not told. But let me tell you that if we import the material, it is at least double cost, minimum. And that minimum cost of the material is double, plus the getting and all that. Then all exercise, taxes and all those things will cost. And that's the thing that it is always said that dental materials are very expensive. But it is not true. Same is the story with the equipments. I used to say this, that now Indian stalwarts should come forward. Yeah, there is no doubt that there are now people who are coming forward in dental materials. There are some who have come forward in manufacturing instrument, equipment and all that. But material is definitely required. And I think I would request Sharad sir and his team, because see, he mentioned about Dr. Patil. There has to be somebody who supports the idea. It's very important. I'm telling you, if I want to do something, I cannot do anything alone. It's a teamwork. So I think I would request your president, honorable president, my friend Sharad sir. I call him sir because he deserves that word. Basically, we just say it as well, but he deserves because he has that, spirit in him that he wants to prove that even if it is a stand-alone dental college, he always used this word, and I told him that stand-alone dental college can also make the difference, and this is the actually story, and I am very happy. I think I am not the right person to do review because so many things I heard about the steps and the procedures that you do first time in my life. But yes, because we are not that, but actually we have to be like that. So I really request all my UG students, because they have long years to go in dental college. It's I think around 5 years to go in dental college if you pass regularly. Then we have a group of MTA students. You have and this masters. You see, I was discussing with one of your research team in the morning, and I said that why this thesis in PG was introduced. It was with the main idea that at least the postgraduate student will come to know what is research altogether. This is a situation. See, whenever I used to, accompany the big stalwarts in the government sector, and my director is around, somebody used to always say in his speech that DMERR is always silent, and that's true. In India, I think this is what is required, and I'm sure that if there are another 10 people like Mhaske sir and Sharad sir, I think things will move on. We hope to work together and do something good and make that dentistry poor basically. No, not poor. What is it? Very expensive people say. Not expensive, inexpensive. बरोबर आहे ना? काय शब्द मला आठवत नाहीये. ज्या वेळेला कुठलाही पेशंट डेंटिस्टकडे जातो त्यावेळेला तो म्हणते डेंटिस्ट इज व्हेरी एक्सपेन्सिव्ह, डेंटल ट्रीटमेंट इज व्हेरी एक्सपेन्सिव्ह. But they don't understand basically, and the cost of the treatment, there are many reasons. Yeah, but be happy. I think there is one verdict which has come that the cost cannot be decided by anybody else than the doctor. Anyway, all the best. I'm very happy, and I'm sure that he will go ahead with manufacturing, and it will make a difference and fulfill the objective to serve the poor group of our society. Thank you so much.
Thank you, sir, for expressing your views and guiding us. Now I request Swarali Zore ma'am .
We will now be initiating for a Q&A, question answer session by the UG students or the PG students to our esteemed guests.
First, UG students, they can ask the questions.
Come on, UGs. What would like to know from Dr. Mhaske, Dr. Pawar? Otherwise, I will feel that it has all gone tangential. Good. Yes. Ask.
Good afternoon, sir. Sir, Ayush, I'm studying in GUG, first year student. So, MTA, so the basic thing that we are using the dental materials for the treatment of people. So, MTA is something that is, you told that it will cost 1500 to 1700 for 1 round. So, while treatmenting further after getting this all patent, the mass production will cost it will decrease the cost, but the substances used or the chemicals used or the process, the manufacturing plant, it will cost more than what kind of things that we will need for a setup.
Good question.
Yeah, very good question.
One good part is like related to the commercial aspect of it, which we were discussing the MTA development activity and exactly a Make in India concept. So what we have been talking about Make in India. So it is exactly an example of making India. If you see the replacement of imports, if you do it by your own, so the cost which of MTA or biotinting or some any other commercial material which you have, it is adding the cost of your marketing, sales and all that we haven't added into this. But the material cost at their end is also not that high which we are being paying at this moment, because there is no replacement of such material available in country. So the material cost, which is 1500 to 1700 grams per, is shown is related to the per gram synthesis and the process cost. Once we do, and as I initially mentioned to you in all engineering concept, what we do is a TRL level development. So in dentistry it is not there, but we say TRL 4, 5, pilot scale, 5, 6, commercial scale. So as we go on to an increase into a process intensification and scale up, cost of the material will come down. Right? One way. Another, that is way, and as your second portion of your question is whether the chemical composition, which is like in 5,000 or 6,000 rupees per gram material, whether the same it will be. So the one slide, if you can remember well, or I can slide down that way, which may be a third slide from the last, where all chemical compositions of biodentin is been present with the MTA which we developed, above which in biodentin you have one of the chemical moiety which is a chlorine, which is not been as such, it is into a very, that quantification also we have done, which is into a 0.025%. But it is there in your commercial sample, even the MTA which we have developed here, there is no chlorine. So chemically it is the same. The chemical identity is the same. Only the process by which we are made is different. And the raw material to come as a final class of that material, which we are precursors, which we call in the chemical reactions, which we have used are very cheap material. And that's why the cost is lesser.
One more question, that you talk
Please.
about the reverse engineering process while
Yes.
doing the research.
Yes.
So during MTA, during MTA or any other thing in particular research, so you started it from MTA and all the descriptions of the basic parts which are included in MTA, the chemical composition. So you collected all those information first and you derived it from a different kind of technique, or you set up a new system for making this MTA.
Right, and I'm happy like you and you thought it this way.
Ayush Mohite. Mohite.
No, but it's really good. I mean, the question which stuck to his mind is related to the reverse engineering. You are in which year of your?
First exam.
Oh, good. You are getting it done right.
Just share experience. One of my students like you only. Can you
Actually, I dropped my biogenetic engineering, IIT Hyderabad. I am a dropout student. IIT Hyderabad.
You was in IIT Hyderabad. Which branch? Oh, that's why your question was so smart. So, because reverse engineering you were talking about, so.
For sure, sir.
So you was in 22, was in IIT Hyderabad. Corona batch, you were in IIT Hyderabad.
For
Biochemical engineering. What was your AIR?
AI was fine. It was around 785. Basically, I was trying for chemical.
Well, how you have dropped out? That is also interesting to know because your AIR rank was too good.
You were trying for chemical engineering.
I was basically from beginning when I started, I made my goal for doing something. I was preparing for chemical engineering government jobs, like the 8 seats for all over India. I prepared for. So that was my basic goal, but that wasn't.
So ultimately you will end up with one institute where your president is a chemical engineer, right?
Yes, objective one thing. I want to really be like the individual and end तक तुझे यही लगता रहे तुझे यहाँ कोई ये ना सिखाए कि तू क्या पागल हो गया था कि केमिकल इंजीनियरिंग करनी
Yeah, no, but I liked it. One thing which he also definitely endorsed it. We as an UDCTN is different thinking process, but those people only go to a chemical engineering, those who wants to become a chemical engineer, not to become an engineer. Because it is not the first choice for everyone. It is very particular choice. Those who are liking not chemistry, we don't do too much of chemistry, which generally people think chemical engineer means chemistry. We do unit operations, right? And the question you asked me for reverse engineering, and he picked up very well from where you are. So, reverse engineering, yes, when we call it as a reverse engineering means you have seen it in my that attributes. The first one is a literature survey. So, your all literature survey and the research methodology, one subject your master student must be studying. It is not only for learning the theory, it has showed how to do the research. In which organization you are, doesn't matter, but it is a flow of doing it and research. So first of all, think it everybody is smarter than a researcher or whoever has been doing it. Don't think that I am thinking first time in the globe. Many a researcher go into that level saying that this is my idea and first time I am doing it. There is a somebody who has done it in the past. So do it in literature first. Through literature, you will come to know that what analysis they have done. Right? So certain analysis is for finished product. As you have done it 1 year engineering, so you know what is finished product, semi-finished and precursors and all, right? And that too in biochemical engineering. Okay. So that way. So during that method, they must have mentioned like which analysis they have utilized to analyze the product at the primary level. So picked up that analysis and utilized for doing it. Your reverse engineering means analyze the product at that analysis and then segregate it. For example, you know FTIR, IR analysis, right? That first year also must have been taught you in IIT. Because their syllabus and our chemical engineering syllabus is quite same. So spectrum teacher.
Rupal, biochemistry. Rupal. Banerjee sir is a.
एक प्रॉब्लम है बैनर्जी जो कूलर में बैठा है और रिसर्च पे बात कर रहा है ठीक है कोई बात नहीं
So once that is, suppose you have done it now, so you will come to know that you analyze with spectroscopy, you will come to know some chemical identification what it is. So utilize that analysis for cracking down the sophisticated analytical tool which is called reversing. And which you can do it in your medical engineering also. Medical engineering is also because when whatever you do in unit operations as and your operations are also one of the unit operation for us. You also go with the blood flow and all. This is a Newtonian flow for us.
See, I'll tell you, unit operation means what? Some easiest example is unit operation. इसमें एक ही example. There are n number of things that you will cover. अपन चाय बनाते हैं, बराबर? चाय बनाने में कितने unit operations हैं? एक mixing, blending, filtration, उसके बाद evaporation. ये सारा का सारा यूनिट ऑपरेशन है इज अ पार्ट ऑफ रिसर्च ऑफ यूनिट यस किसको बहुत आवाज आ रहा है यूजी तुम्हारा पूछो सवाल जाओ मेरे तरफ से I have only. Anybody else? Somebody from final year? Good. Take it away. I feel better with you. Ajay. Anybody from 2019 batch? You are on the verge of passing out. Come on.
Sir, my name is Amara Saida. I am from second year BDS. My question to you is that since you have mentioned that dental materials are very expensive and it is due to the fact that we are importing them. So what are the parameters or what are the things that we require so that these dental materials can be produced in India in a very short span of time despite or elongating it? Because in that time the other countries would advance further and we would be using their technology which is before the time that they are utilizing.
Okay. Yeah, so that again the same way your question also has an it's a single question but it has an two parts of the answer. One is like we as an materials and engineering concept utilized into how much time it will take is also your medical science supporters. Your CRO, CDS, somebody or whatever you are talking about ICMR, if they are taking it and too much of time to pass it on one single material, so we may develop within a year 10 materials, but you take 5 years to certify the materials, so that time will go. That is not there in, so policies and that mandate is also to be shortened down. By that way the maximum lead time goes there, right? Another part, if you do it in systematic way of doing it and really in a research, in terms of innovative type of, research is anything if you want to dig out an information becomes a research. For example, everybody is talking about nanotechnology in all fields, not only into chemical sciences but into medical sciences also. So any dust particle becomes your nano size, becomes nanomaterial? No, otherwise nanomaterial would have not been a recent technology. So the nanomaterials into an innovative way if you convert into, which is dispersion of this material, surface area and whatnot. Systematic study if you do it of any material in dentistry, your time requirement for development will reduce. Initially, in engineering language, we always call capex and opex, right? So when we call it as a capital cost and operating cost, so capital cost should have certain law by which the return on investment comes down and all. It generally in any process of chemicals we talked about that. So our capex is related to the right set of benchmarking it and analysis it at the depth. If you just do it like 4 or 5 research articles, some paper, somebody has done it, you follow the same way, you will take a more time. So, and don't do it with the same way what they have done it, because they definitely must have left some crux of it which they never mentioned into open literature. If we also do it and patenting and open the complete thing, anybody can make the MTA. It's the same like what he has just mentioned to you, making a tea. If there is a standard tea,
where they will be better than us. The teachers are expressing which is always
okay, that way. So because in generally in our field we don't keep too much of hidings because our processes are quite open. Only the innovative approaches we keep it to the processes. So if you do it an innovative type of research, I think so time will be curtailed down and maximum material we can do it into a replacement of import in dentistry. Hope I have made your answer clear.
Thank you, sir.
Yeah. Next. Final year, this first year and second year seem to have overtaken you. Where is the 2019 batch interns? Teaches of endo department.
Good afternoon, sir. So myself, Dr. Kalyani from Department of Conservative. So my question is, what should be the powder and liquid ratio while mixing this, while the manipulation of this MTA before placement?
Okay. It is like, and what the MTA which we have developed, that I am talking about. The standard one which you probably know how much is the ratio. The MTA which we have taken it, it's like a 90 to 10 wet by wet ratio, which is like if you have a certain moist, cotton moist pad also, if you place the MTA, it will get it gelled or it will get it cured. But if mix it into an water and then make the paste and fill it, so it is weight by weight 90:10. So 90 parts is the MTA, 10 parts is your moisture, which is water in your case.
So my another question is, what are the changes that takes place in the pH? Means immediately after the manipulation and after the final set.
What step?
So what are the changes in the pH?
pH level. Okay. So pH level in this case is not going to change because there is no chlorine content in our material. So the other commercial material is where there is a chlorine content which has been changing the pH. In our case, once the material will be mixed or MTA has been formed, there won't be any change in pH level. There won't be any change in pH level. Thank you.
Anybody else in PG?
Good afternoon, sir. Myself, Dr. Govt from Department of Conservative Industry and Agronautics. So my question is, so when we are using normal MTA, so there is during setting it has some expansion. So it seals the area and it has got better properties. So is there any setting expansion in our MTAs?
Yeah. It is like into, and this is the material which we have made, it is all our inorganic material. So it won't give you the expansion in terms of the filling part. It is like the amount of mass which you add it only a swelling ratio, right? Which you are talking about is a swelling. So swelling ratio here is like an 9 to 9.5% more than that of its basic volume. It will swell after the addition of water into it, in the MTA which we have. Otherwise it won't swell much because this is completely an inorganic material. So it will rather have a more compact and densified material it is.
Thank you.
Thank you.
Both of you are from Indo department?
Yes.
The one who asked the question is?
Yes.
You asked this on your own or you were told by your faculty that hey, सवाल पूछने का नहीं ईमानदारी से बताओ नहीं तो प्रेसिडेंट नाराज हो जाएंगे. Tell me honestly, you asked this on your own or you were told to ask? Good. If you asked on your own, great.
Good afternoon, sir. Myself Prajakta Hira from Department of Periodontology. I had read an article regarding MTA helping in regeneration of the periodontal tissues. Would that be the case in our MTA?
No, I mean, with that angle, we haven't studied our MTA. Till time we have studied our MTA in terms of the benchmark sample, what all analysis it is. Even related to the biological study, that's it, we have been asking in the morning to give it to you. And they should think in this way.
Yes. Have we allotted this topic to anybody?
Yes, sir. We are planned for allotting it once we get the material.
Now we have the 100 grams material with us. Any given time, even tomorrow we can able to send you that material. Because that kind of what she has been talking about, it is not our expertise to look into.
Anybody else? Teachers?
Very good afternoon. Yeah, very good afternoon, sir. I'm Dr. Jasmeet Chandra from Department of Process Aeronautics. I would like to know, sir, chemically we bought a product, we have segregated it, and we made a new product. Now, what extra we have with this product, which will be more beneficial if we sell it commercially?
Yeah, there are two extras which I have already mentioned to you. One is like chlorine free, another one is a cost, which is this two extra. The third extra is like this material has an susceptibility which we haven't even triggered it yet, but it can even go into an UV curing. So it ultraviolet source, if you just placed it, then you will get into the curing of this material also. That sort of modification we have already incorporated into this MTA.
And sir, one more thing I would like to ask.
Please.
Right now we are making a single product. If we are going for a manufacturing, we should be having multiple products at a similar time, so that overall we will be able to set up as a corporate. If we make it a corporate connect, we should be having multiple products.
Take initiative. I am your investor.
So that will reduce the cost, and that gives more credibility to that particular institute or producer doing it.
That's why we are working, but if you want, you can be part of that. We are working on it. It is our exercise in scaling it.
Thank you.
Very good afternoon, sir. Myself, Dr. Jayashree from Process Aeronautics Department. My question is, sir, as you said, it is available in the form of powder.
Yes.
Is it possible we can, the availability can be two forms, like two base system we have other materials. Like one is powder form, it can be have a catalyst or in a distilled water. I don't know whether we can mix it with the tap water or distilled.
Yeah, the material which we have developed here, even just a normal water without catalyst, it will be get cured. So any moisture, even saliva or what, any moisture, it could able to even set it. It is not related to an accelerated material which you need to have certain catalyst or accelerated added and then it will start. It is just a moisture cured material.
It would be in the paste form would be more better so that you can fill it with all the details. Like there are minor details in the truth structure.
Achha, you meant to say that rather than a free flow powder, it should be in the paste form. But the addition which you are, I mean, generally the standard samples are like your powder which you added in to make the uniform paste and then you fill it, right? Because whenever you add it as a paste, so you are adding it and the moisture to it, which is H2O or water. So there will be always one tendency to form the microbial growth also onto it as far as the medical, toxicological activity. So generally free flow is preferred to be in terms of more hygiene and more safety into it. But addition of the lower concentration of water, it will not cure, so that way we can try. But whether it will form a paste or it will form an aggregate, that I cannot tell you at this moment.
Sir, good afternoon. Sir, I would like to ask, this material is radio opaque, like once you insert into the tissue, you need to, patient comes for recall and all. So that time you cannot open again tissue and see if our MT is there or not. So this should be, ideal should be radio opaque.
I think it will work the way it is, but that particular material will send you that, and this particular study you do it and tell us whether it is, because
it has a barium in that, so I think usually barium content will have radio
that
opacity.
particular concept of the study which we cannot do it, and whether we don't have that kind of things to be worked on.
You give this topic to some
It must be because on the basis of chemical structures which we have, as your answer to it, yes, it will work. But whether practically it will work or not, only medical doctor can say.
Good afternoon, sir. I wanted to ask the coefficient of thermal expansion with the tooth. Will it have any effect?
No, the coefficient of thermal expansion of the tooth, it will not affect. That's why I've said the expansion ratio is 9 to 9.5% only. Rest of the things added is because of the heavier inorganic mass. The compactness is more. So the coefficient of expansion will not be the case affection related to the MTA which we have.
So we will not expect any shrinkage.
It will shrink after the setting. Any material which will be initially get into the paste form, that time it is expanded one. Once you fill it, once it will set, it will remove the moisture out of it and it will shrink. But the percentage of moisture requirement itself, it is low. So that time the shrinkage, percentage shrinkage will not be more than that of to 9 to 10%. So that is good enough.
Good afternoon, sir. I am Dr. Shikit Mishra from Department of Conserved Dentistry and Economics. Sir, as you mentioned, sir, chlorine will not be there in our sample. So, and you also mentioned the advantage if it will not be there. So, what other properties can be modified due to absence of chlorine in our sample? What are the properties?
No, that way it is not like in comparison with the chlorine. If there is no chlorine, because chlorine is not been used as a performing material there. The biodentin against which I have mentioned to you that chlorine is coming because of the certain precursor and process which they used. There the free chlorine has been present. It is not that the chlorine is a functional material in your MTA. It comes along with the product, but that to be into a complex form, which we could able to eliminate. So there is no extra weightage. Rather, not having chlorine will give you more safety factor to our material. That's the only thing.
One more question, sir. Regarding the hardness. Regarding the hardness of MTA, will it be similar to that hardness of dentin?
Yeah, it will be the same. Rather, here in the compression strength which we are been into, and that 60-68 megapascal and all, it is coming into a same region, rather 1 or 2 megapascal up. Which, because even in certain literature, I don't want to say that way, but at least into an R concept, 67-68.3 megapascal, 0.3 will not value into a megapascal. 10 to the power 6 Newton meter becomes mega. So in engineering concept, 0.3 megapascal is no value. You say 67 or 68 or 69. So we'll be having 1 or 2 megapascal higher rather than comparison. So there won't be any worry on it.
Sir, one more question regarding the workability. The currently used MTA, it has got the difficult to manipulate or difficult to work with. So when you mix with our sample MTA with that of any of the liquid you mentioned distilled water. So if you mix it, is there any problem while mixing?
No, the mixing and dispersion of this is very nice as far as what we have done it with the spatula and plate. But we don't have that same skill set which you needed, so that's why we are sending the sample. You worked on it and tell me that whether it has the same workability or no. If needed some modification, we'll definitely do it.
Apart from this thing, the compressive strength. The compressive strength of MTA, which earlier was used, it was after 1 hour it attains.
It is 24 hours and then 21 days is generally mentioned in MTA. So there is any inorganic material, it is always given higher compressive strength lateral descent because it will get it fully cured.
Okay.
So in this our case is also the same because we are not changing the chemical class of it. We are keeping the same chemical class, otherwise you won't be able to set into the tooth.
Right.
Just by making it an any Portland based cement, as he has mentioned, it was easy task. I mean, it will get it set, but here it is not the case. So that thing will not be challenged.
Okay. Sir, one more question. Sir, you said that this powder can be mixed with liquid, for example, distilled oil. I want to ask you, can it be mixed with local anesthesia molecule or can it be mixed with saline? Because
that I don't know, even I don't know the IV ka
saline, normal
anesthesia वगैरे तुम्ही करो
सिर्फ इतना मत करना जैसा अपने डिपार्टमेंट में हुआ था, एनेस्थीसिया की जगह पे फॉर्मली नीचे किया और मत बोलना कि अरे यार क्या MTA बनाया, ऐसा मत करना, ठीक है?
Okay, thank you, sir. Thank you.
Sir, right now when we are using MTA, we are facing one problem, that is of setting time. For that, we are calling patient twice or thrice. We are giving 2 sitting appointments. So what will be the setting time of our program?
Here is also the setting time in terms of you are talking about sitting for twice and thrice is related to this. I am saying the setting time related to once we add the material,
Yes,
then how much minute it will be set.
Yes,
Your
sir.
currently is like 18 to 20 minutes it
So
sits,
it
right?
is 2 hours 45 minutes. 2 hours 20
The longer one,
Yes,
the longer one,
Yes,
right?
sir. Yes.
So here is also the first, because what we say into an setting time is like an touch dry, hard dry,
Yes,
surface
sir.
dry, which you just see it the hard dry,
Hard, yes.
which is 2 hours. But
Yes,
the
sir.
first set, which is 18 minutes, here is also rather coming 17 minutes. So the hard dry must be higher, lower than
Lower
that.
than this. Okay. Then and one problem is that when we will be using this material, definitely we might having failure in some cases. We need to retrieve it out. So we have any chemical which will be easy to take it out from the root canal because it will go very deep into the canal. So we need a material which can retrieve it also.
Yeah, this can be retrieved. This can also be in the same way which you can remove it way. Because here even into and the same, that's why I've said last time also, the chemical composition of the final product we haven't changed. Which is the property of the final product. The regeneration of your anything is related to the final product parameters. That remains same except fluorine, everything is there same. Quantification wise it is different. Right?
Sir, what will be the final consistency of our product? After we mix the liquid and after we mix the powder and liquid, what will be the final consistency of? So we will mix the powder and liquid. After that,
What do you mean by final consistency? Because that term
so
is not
powder and
family.
liquid we will mix. After that, it will be in a gel form or it will be.
It will be into dough form. It will be into the paste form, which will be in dough form. It's like a highly viscous mass, but not a solid mass. So high viscous mass.
Because as my student had asked that can we use it for periodontal regeneration, so we'll place in the pocket, it should be repeated. Yes.
That I can't say.
Anything else?
Now I request Swarali Zode ma'am to propose the vote of thanks.
Good afternoon everyone. I am Swarali Zode, the Student General Secretary for the session 22-23. There are dreamers and there are planners. The planners make their dreams come true. And today's event was one such dream turned into a reality by our dedicated planners. I express my heartfelt gratitude to our Honorable President, Shashank sir, for sharing his exceptional vision and taking every opportunity to discover and rejoice with us the greatest science, innovation and research. We are honoured and extremely grateful for the presence of our esteemed guests. Thank you Professor Dr. Shashank Mhaske sir for being a part of today's event and illuminating us with your very insightful words. I would also like to thank Dr. Mansing Pawar sir. We are beholden to you for being here with us today and for sharing your inspirational experiences and guiding us with your precious knowledge. I'd like to sincerely thank our respected Dean Dr. Deepak Nagpal sir for his enthusiastic support and dedication for making this event a success. I would also like to thank the Master of Ceremony for today's event, Ashlesha and Amara, for the smooth conduct of this event. Lastly, I'd like to thank our teaching and non-teaching staff, our IT team, and all those who have worked behind the scenes to make today's event a great success. Thank you one and all present here.